So let's do mitral stenosis. First of all, let's start with basic. Okay, do you know mitral wall? I know everyone knows that what is mitral wall. Mitral wall is situated between LA and LV. Okay, that is a valve present between left atrium and left ventricle. Okay, when the blood passes from left atrium to left ventricle, there is a valve which opens and closes. Okay, for the smooth transmission of blood. So what happens is in mitral stenosis there is narrowing, okay, and stenosed wall, that is, okay, normal is 4 to 6, okay, and in this stenosis the thickness of this wall decreases to 2 centimeters square, okay, that is abnormal, so that is narrowing. So what will happen if this wall is narrowed? Backflow of blood would happen, backflow of blood would happen to the left atrium, okay, the blood gets stuck there. Left atrium pressure will increase, leading to hypertrophy. This is very important point. I was sitting in a consultation room with the MD physician and he asked me one simple question. Okay, what happens in mitral stenosis? What what gets hypertrophied in mitral stenosis? His options were left auricle or left ventricle. And I was thinking, and I will use my logic without getting my basics clear. I answered left ventricle and he scolded me very badly. So you don't want to suffer that. That's very important. That mitral stenosis may left auricular pressure increases. That's why left atrium dilates, and that's why there is a left atrium hypertrophy. Okay, so that's all. Now we'll see here left or went. Okay, LA to LV. Okay, so when the pressure in LV increases, pressure increases in left auricular, pulmonary vein pressure also increases. That will lead to pulmonary congestion and dyspnea, orthopnea, and PND. This is very important clinical side symptoms. Let's box it up. Now, what will happen here is left auricular dilates. Okay, this is our left auricle, this is our left ventricle, left auricle, left ventricular. This will dilate due to that blood stacking inside, and that will cause what? That there would be afibrillation, and that's why there is a stasis of blood inside left auricle that will cause clot formation and stroke and embolism. Okay, now then we have pulmonary hypertension, right ventricular overwork, right ventricular failure, and we have edema and hepatomegaly. Okay, now very important. How do we remember all this stuff? It's very easy. We remember MSD. Okay, who is MSD? MS Dhoni. So we say mitral stenosis diastolic. Okay, this is very important. Mitral stenosis diastolic. Simple. Now, very peculiar thing about this is opening snap. Okay, when the valve is tenosed, or when the pressure in the left auricle increases and there is a high pressure there, there is a snap opening. Okay, still opening, snap or stiff opening. That's why it's because it's pop sound. That is a snap opening. Force opening, more severe, snap close to S2. Okay, this is written somewhere. Now we talk about the murmur. Okay, so when would this kind of murmur be felt or heard? This is very important and this is very easy. Of course, when that valve is stenos. Okay, so what will happen is when a left auricular contracts, all the blood will come there. Okay, simple, simple. Now when it will relax, the wall is stenos, it does not go back. So when it is relaxing, a little kind of blood would go up. That would cause murmur, that is mid diastolic. Okay, LA and LV in diastolic. Low pitch rumbling murmur at apex, with presystolic accentuation. Okay, let's see. Mitral valve narrow. Okay, mitral valve is really narrow. Blood flows through the small opening, turbulent flow during diastole. Okay, ये नीचे की तरफ the blood will come नीचे की तरफ. Okay, but during the relaxation there is turbulent flow. Okay, so that's why it causes low pitched rumbling sound. Okay, and it will, this is very important, you have to get this in your heart. That is S1 S2 and uske baad will hear opening snap. Next what we have. Okay, that's all about mitral stenosis, I guess. Yeah, that's all. Thank you so much for listening to me. What's important in here? You see the pathophysiology, you see the diameters, you see the murmur. Of course, it's gonna be diastolic, low pitched, and rumbling murmur at apex. And you see this location, and you remember MSD. That's all for joining me. Bye bye.